La stratégie nationale santé bucco-dentaire, c'est vraiment une opportunité de pouvoir répondre aux besoins de la société, aux besoins de la communauté canadienne, aux besoins de la population canadienne, au niveau des défis sociétaux, environnementaux, technologiques et même scientifiques aussi.
One of the areas in oral health care I really liked was the focus on environmental sustainability. During the pandemic, we really saw the impact that dentistry can have on our environment by the level of things going to the landfill, for example. So really that notion of how do we invest in looking at more environmentally sustainable products, things that are used, and what's our impact?
So how to make progress in providing quality dental care without damaging the planet further. So that's so important. And also the environmental aspect was considered in provision of dental care, but also in training, research. So it's very interesting to see that the WHO Global Oral Health Action Plan aligns very well with the National Oral Health Research Strategy in Canada. This environmental aspect is very common to both of them.
And the community has identified the fact that environmental sustainability and the contribution of healthcare, and particularly obviously in our field, dental care, to the problems of climate change is something that needs to be thought about and researched and addressed, because it affects everything we do. It affects care, but it affects also the research. You know, when we're in our labs doing research, we have to think about what are the effects on the climate of the approaches we use, the materials we use, the electricity we use, whatever it may be.
Il est temps que la médecine dentaire puisse embarquer, qu'on puisse penser également à d'autres enjeux, à tous ces déterminants-là au niveau commercial, au niveau environnemental, au niveau... et de voir la valeur ajoutée de la technologie, parce que en dehors d'améliorer l'accessibilité aux soins, en matière de soins et de services bucco-dentaires, il y a aussi l'impact environnemental qui est à considérer. Tous les voyages, le transport, le matériel en médecine dentaire, on pourrait optimiser. Donc, c'est vraiment le temps. Et puis, je reviens au fait que c'est là où la mobilisation des connaissances et les sciences et la mise en œuvre vont nous guider.